Now we've covered the entire chest spine chapter, which is a short chapter section comprised of 大仙胸堂, 大仙胸 and 小仙胸堂. Now these formulas are typically located in the Taiyang section. Well, canonically they're located there. But nowadays, if you look in most books on the Shanghan, a lot of times they'll be located in the Yangming section, typically in the Yangming section. So if, for instance, when you're doing a case report or something, and you're asked to, you want to use, for instance, 小仙胸汤 or 大仙胸汤, and you need to provide a confirmation, right? You say this disease is a Yangming confirmation or Taiyang confirmation. You can say Yangming, no problem. So just something to note there. You can also say Taiyang because that's where it's been located canonically. Now, on to the Glomus section, which is comprised of quite a few formulas. And starting, of course, with Banxia Xiexin Tang. So let's now have a look at the definition of Glomus here. So this particular picture here on the left is from this book here. Oh boy. Okay. That's not very good. You can see that, which is, you could translate it as like curious viewings or curious observations of Fukushin, or you could also call it like miraculous observations of Fukushin. So Japanese book on Fukushin. And this particular picture shows, could be, I think, Huanglian Tang, I think is what I took from the look of it. So you have this, you can see here that they very clearly show where the diaphragm is, and then you have this feeling below it, right? Above is something particular to Huanglian Tang. Now, an easy definition for glomus is like a feeling of fullness or congestion below the heart, substernal, right, in this area, that is typically only sometimes painful if pressed. So actually, in some instances, glomus just isn't painful at all. It's just a feeling of pressure, sorry, not of fullness or congestion, a subjective feeling on the part of the patient, which is oftentimes not painful at all. Now we'll see as we go forward here that actually certain commentators and certain physicians have different opinions on this, but this is sort of a standard definition. Okay, so if we look at the genesis of glomus here, we can look at line 131. So this is something we looked at before from Daxian Tang. If the patient suffers yang disease and is purged, heat invades inwards and results in chest bind, right? So that's what we just looked at. Now, if the patient suffers yin disease and is purged, they will develop glomus, okay? So with yang, we discussed what this is. What, you know, if they're yang and they're purged, it's going to turn into 小仙胸汤 or not 小仙胸, 大仙胸汤, right? And then if it's yin, well, what does that mean in terms of what is yin disease in this particular situation? Well, you can look below here at line 7, where it says heat effusion with cold aversion is a disease presenting in yang. Lack of heat effusion with cold aversion is a disease presenting in yin. So that's led some people to believe that what's meant here by this patient is suffering yin disease is like a Shaoyin exterior pattern. So that would be like Sini Tang. And then there are also people who say, well, actually what they mean by yin and yang disease is yang disease is like Guizhi Tang, like a wind damage. And then yin disease is like ma huang tang or like cold damage. So those are two different contrasting ideas on it. Now, in my opinion, I think both are valid, but I tend a little bit more towards this Sini Tang idea. So, in any case, the important thing to note, I think, if you accept this idea that what they mean here in this line when they say the patient suffers in disease and they will develop glomus, is that actually in glomus, oftentimes they're starting off with more deficiency. Okay, so we noted in Yang disease, which we said Cao Yingfu believes that's like a Guizhar Yuebi pattern. In that particular situation, we said they have a little bit of a Yangming repletion on top of the exterior pattern, right? And that's subsequently exacerbated by either the purging or by the drinking cold water. Now, in yin disease, they're not only just like in yang disease, they're purged, but they started out with deficiency. So you'll notice for glomus patterns like Banxia Xiexin Tang, Ganzhao Xiexin Tang, Shanghan Xiexin Tang, Lizhong Tang, Wanglian Tang, all of these glomus patterns, for the most part, besides Dahuang Xiexin Tang, there's often a component of this deficiency, and that's reflected in the architecture of the formula, where you oftentimes have ganjiang in the formula, and you also have dangsen, gancao, right? So banxia, so these warming herbs are in there already, whereas you look at something like Da Xian Tang, it's all cold herbs, right? So that kind of tells you. Now, I said we would look at a few, we would look at some other definitions of glomus. Now, the Japanese are really, really strong, right, on palpation and abdominal findings. So one of those, the greats in modern Kampo is Kisetsu Otsuka. And so his definition is a sensation of substernal fullness, stagnation, or discomfort, like we said. Now, he says, strictly speaking, it won't be painful upon pressing, right? From if we just look at the lines themselves, but actually in hard glomus, like Shanghan Xiexin Tang or Ganzhao Xiexin Tang, there will be a feeling of resistance upon palpation. So what does that mean, resistance? Well, that means when you push down, there's a little bit of resistance to your hand, right? And he says in pure glomus, like in Banxia Xiexin Tang or Dahuang Huanglian Xiexin Tang, you might not feel that same resistance. Okay, so this is strictly speaking, right? If we're really going by the book, so to speak, Shengjiang and Ganxiao Xiexin Tang are called hard glomus, so they might have that. On top of having a subjective feeling of congestion, you might also be able to feel a little bit of resistance there, like you would be able to feel with, for instance, in Xiexin Tang. Now, on top of that, another objective finding that you might be able to find in some cases is that for these glomus patients, when you do your palpation there substernally, you might hear a watery sound. And that, of course, has to do with this dampness or this room that's accumulating substernally. Let's have a look now at the first glomus formula, which will be Banxia Xiexin Tang. So if we look at Banxia Xiexin Tang, why is this skipping around? Sorry. We have the first line here, which says, after 5 to 6 days of cold damaged disease, the patient presents with vomiting, heat diffusion, and all signs of a Chaihu pattern. The doctor instead elects to use purgatives. If after doing so there's fullness under the heart without pain, this is glomus. Chayu formulas are not indicated. It is advisable to use Banxia Xiexin Tang. So we haven't really looked at Xiaoyang patterns yet, but obviously, as we talked before, just in this previous case study with Liu Duzhou, we said in Xiaoyang an important symptom is vomiting, and then so they had all signs of a Chayu pattern, but instead the doctor uses a purgative. Why would they use purgative? Well, maybe they saw, for instance, in Chayu patterns, you have fullness in the ribs and in the chest. Maybe they said, oh, that must be like a replete fullness. I'll just use purging. But actually they still had an exterior pattern, so that wasn't the right move. And so as a result, this fullness comes under the in the substernal area without pain, right? So we said in these glomus formulas, technically they don't have pain. Actually, some people say they do. This is glomus, and Chayu formulas are not indicated. So let's look at that mechanism a little bit for Banxia Xiexin Tang. So we said they give us a little hint here, which is that the entry for this disease is via like a Chayu pattern that's then purged, right? Well, what do we know about Chayu pattern? Well, blood and qi this is about Chayu, Xiao Chayu Tang pattern. When blood and qi are deficient, the interstices open. Evil qi is able to enter where it struggles against upright qi lodging below the ribs. So we know that in a Chayu pattern, there's already a degree of blood and qi deficiency. That's why we see the use of dangsen in Xiao Chayu Tang. We also have, of course, gancao and dazao in there as well, also supplementing blood and qi. Now, there's another pattern of entry we said, right, which is that in glomus formulas, it's if there's an yin disease, quote unquote, and is purged, it becomes glomus, right? So, and you can see this, for instance, in Sini Tang. There's fullness and bloating in the abdomen, right? So you can, with an exterior and an interior element. So just like in glomus, yes, Sini Tang even can have this feeling of fullness, right? And so the important thing to note here is that absolutely in like a Banxia Xiexin Tang pattern, there is a degree of deficiency. On top of that, though, there's also a degree of repletion. So how does that occur? So as we said, in contrast to Da Xian Song Tang, in Banxia Xiexin Tang, there's going to be some level of deficiency. And then that's exacerbated by purging. So we get even more cold below. Now, what happens? Well, Huang Yuanyu kind of gives us a cool answer, which he says, as these lower burners cool, yin qi congeals. Okay, so how does that happen? Well, you can imagine if the spleen and the kidney are responsible for steaming and transforming fluids upwards and outwards, if that function is somehow damaged via this purging, then obviously these fluids begin to then not congeal, but accumulate, right? And then eventually they could congeal. Now, as that happens, obviously we also have yang qi trying to move downwards, right? We have that the lung moving that yin qi down into the organs. Well, it gets congested and stagnated, right? Because you have this blockage there. And so that leads to upper heat. So now you have that classic situation of that heat above, that cold below, right? And so Banxia Xiexin Tang is sort of known for being able to deal with that, right? Now, another thing that might contribute to that, these congealed liquids, you could say, is, well, as Liu Duzhou says, Xiao Chayu Tang actually Banxia Xiexin Tang actually comes from Xiao Tang, right? At least in this canonical sense. Now, so in a sense, this Banxia Xiexin Tang would then inherit this phlegm, right? So another reason for that. So all of these things would contribute to there being this fluid congestion, which then blocks that that heat moving downwards, right? And so this heat above, cold below. So if we want, again, a pithy mechanism gloss, so we can use, again, when we're talking about case studies, well, Liu Du Zhou says this is spleen deficiency. You can also say spleen or lower burner deficiency with poor transformation and movement, leading to dysregulation of ascent and descent, heat above and cold below. So this dysregulation of ascent descent we just talked about, right? That's the spleen and kidneys are no longer steaming and transforming upwards and outwards, right? So they're just sitting there below and not ascending. And then this heart fire, which is trying to go downwards, is unable to descend. So you have this dysregulation leading to this heat above and this cold below, right? Now, again, much like with the chest spine formulas, Banxia Xiexin Tang is also grouped canonically under Taiyang. But in the modern era, for instance, most notably with Hu Xishu, it's going to be grouped under Jueyin. And the reason for that is Hu Xishu likes to put formulas that have this heat above, cold below, all in Jueyin. So another formula that he puts in there is Chai Hu Gui Zhi Gan Jiang Tang. He doesn't put that in Saoyang. And he puts all of these Glomus formulas, the Xiexin Tang formulas in Jueyin. So that's a valid way to characterize it. Now, there are also people who, more compo people who will put it in Saoyang, Taiyin. This being because, on the one hand, Taiyin relating to that sort of deficiency of the spleen, and then Saoyang because you have the main contradiction, so to speak, or the main struggle between the pathogen and upright qi occurring sort of in this middle area along the diaphragm, which is sort of traditionally the realm of Shaoyang. And so some people will say that as well. So either of those would be legitimate in my opinion. Saoyang a little bit less so because we say Banxia Xiexin Tang doesn't really have those same indications as a typical Shaoyang pattern. So I find that a little bit less viable, and Jueyin a little bit more viable because actually Jueyin is not very well defined anyways. Here we have a schematic for the Banxia Xiexin Tang mechanism. Now you'll note that on top here, I say that this is Xiao Chai Hu Sini Tang. So what I'm saying here is in the first stage, right? This is prior to it becoming a Banxia Xiexin Tang mechanism. You already have this congestion occurring in this, you can say in the membrane or in the diaphragm. And so that's one aspect of the formula. Sini Tang, the congestion would be a little bit more dispersed. And then the other thing to note, of course, is that you'll notice that these arrows denoting the Wei Qi and the Ying Qi are like a lighter pink, meaning that this is like upright Qi is a little bit damaged already in these two formulas. I was Sini Tang using the Fuzi Ganjiang Gancao and Xiao Chai Tang using Dangshen Shengjiang Gancao Dazao, right? There's a level of deficiency there, right? So now what happens? Now the patient gets purged, so it's even a worse situation. And now we're in Banxia Xiexin Tang territory where we have this, on the one hand, this congestion, right, in the middle, right here, and on top of that, you have this heat as a result of this heart fire trying to come down and getting blocked. Right, so there's your Banxia Xiexin Tang schematic there, right? So let's look at the dosages now. First of all, in Banxia Xiexin Tang, we have Banxia, Huangqin, Ganjiang, Rensen, Huanglian, Dazao, and Gancao, sorry. And so we have some different recommendations here. Hu Xishu has Banxia at 15, Huangqin at 10, Ganjiang at 10, Rensen at 10, Huanglian at 3, Dazao 4 pieces, Gancao at 10. Now, of course, again, this Rensen can also be switched out for Dangsen. Huang, by contrast, he puts Banxia at 10 to 15, Huangqin at 5 to 10, Ganjiang at 5 to 10, Rensen 5 to 10, so on and so forth. And you can see that for Huang, he can sometimes use slightly lower doses in Banxia Xiexin Tang. Okay, so let's now take a little peek at the herbs here. So the first herb, this is, can you guess? I assume you probably can. This is Ganjiang, right? And this is the areas that we see it primarily being produced in. We have Yunnan, Sichuan, what is this? Guangxi, right? This is Zhejiang, I think, Hunan, and Fujian. Not perfect on my Chinese geography here. So, Zhang Zongxiang, the Qing Dynasty Materia medical commentator, says Ganjiang's acrid warmth powerfully restores yang to the middle jiao, driving the transportive processes of the damp earth. So we know, of course, that after purging, the yang that's been carried down in the blood is and pours into the stomach is reduced. It's carried out in that fluid, much in the same way that sweat carries out yang qi from the blood. Now, oh boy, sorry about that. Getting ahead of myself here. So the spleen relies on this blood yang to drive transformation, right? So it needs that yang to drive the transformative process of fluid. Now, this is why, for instance, Todo Yoshimasu says herb patterns states that ganjiang's real purpose is to drive out fluid congestion. So oftentimes we hear it's warming or something, but actually Todo Yoshimasu actually goes right to this idea of it being important for fluid, which is an interesting idea. But one that sort of holds up in certain cases. For instance, here in Banxia Xiexin Tang. Now the next herb, of course, can we guess this one? It says in Chinese. This one is Huangqin. So for Huangqin, fairly simple. We said, well, I'm not sure if we did Huanglian yet, but for Huangqin, it's indicated for dampness that occurs due to heat. Now, Huanglian is for heat that occurs due to dampness. This one is for dampness that occurs due to heat. So that's interesting. How does that occur? Well, you can think of it this way. Like, in Banxia Xiexin Tang, we have this congestion, right? We're saying if this is sort of the diaphragm here and the middle burner, right? You have this congestion here. Now, we have this heat coming down via yin qi from the heart or from the lung, right? And trying to push down into the abdomen. Well, if there's resistance, what happens? well, you might even just get more fluid congestion. Why? Well, you can almost think of it like if you have, say, like a blood vessel or something, right? And it's traveling along, and then it meets up with congestion right here, right? Well, if it starts to back up, sort of, right? It's backing up, it's backing up, it's backing up. Well, it might extravasate, right? Some of that fluid might end up extravasating, right? And so then you get this dampness, this sort of like extra the interstitial fluid building up, right? So that's one way of thinking about it. Now, what happens then? Well, if you have all of this even more fluid backing up, well, then you get into this Huanglian issue, right? Because you have, again, you just have this buildup of this blood is carrying heat, right? It's carrying heat in it. So if it gets stuck right here, well, then of course it's going to generate heat, right? It's this stagnant heat. So hopefully that's helpful. All right, now the last formula here, or the last herb here, I hope everyone can recognize this one. This is pretty iconic, right? This is Rensen. Now, Rensen steams fluid up into the lung vessel where it becomes blood. It aids in transportation and movement outwards. And you might say, well, isn't that kind of what Gancao does? Well, Gancao, it just aids in that transformation, right? It just aids in, for instance, this sort of absorption of fluid and essence into the circulation, into yin qi, but it can't really then do much into it does a little bit, but it doesn't, it's not quite as strong in that transportation and that steaming fluid up into the lung vessel sort of action. That's really where Ren Sun tends to shine. Okay, and so there's a quote again from Zhang Zongxiang who says, Ren Sun is yang within yin. It allows qi that enters yin to transform into fluid, not fire. Okay, so this is sort of almost like a Li Dongyuan kind of idea of that, like a yin fire kind of idea, where this qi is sort of, it's more denoting yang qi, right? So if you have yang qi coming down, right, but you have deficient spleen that's unable to transform and transport these fluids and this essence outwards, right? And it's just stuck there. Well, if you have all this stuck fluid, right, in essence right here in the stomach, well, then of course this yin blood heat, this yang qi coming downwards is going to get stagnated, right, and turn into fire. Well, if you have smooth transport and transportation, then that fire can be used to continue to drive that transportation and won't get stuck in there. So that's what he means by that. And that's sort of the idea behind in fire as well. Just to give a visual schematic for Rensun there, we said what it can really do that distinguishes it is to drive that process of transformation and transportation upwards and outwards. So we see it's slowly sort of reviving that yin qi, moving outwards, giving this stronger outward push to the circulation, right? Okay. So, and then of course, herbs that we've already looked at, we said Gancao, it sort of helps with that absorption of fluid from the middle and lower burner into the vessels and channels. Huanglian, of course, we said when heat emerges due to dampness, right, as opposed to Huangqin, which is dampness due to heat. And then Banxia is unblocks phlegm, of course. So if we put those all together, right, well, we have Huanglian, Banxia, Huanglian, of course, Huangqin here, where they're both sort of treating this contradiction and this struggle that occurs with dampness and heat. Banxia sort of helping to unblock that phlegm, ganjiang warming the stomach and driving the process of transformation. We have, of course, then ren sen, jeepers. We have ren sen, then of course pushing outwards, and of course da zao, which can bring it back, and we'll keep everything within the circulation. So we have that strong concentration of this yang qi in the blood, which allows to also strengthen the spleen transformation, right? All right, so now let's look at some more interesting stuff. Of course, we have the formula patterns. So the first person we're going to look at is, again, Lo Xiaokun, or Lo Kun Shou. What did I say? LKS. It's Lo Xiaokun. I wrote it wrong up here. It should be Lo Xiaokun. So the number one thing, of course, is this glomus, this full bloated feeling in the substernum. It might feel slightly hard, right? So there might be also, on top of the patient's subjective feeling, there might also be an objective finding there, right? And on pressing, it might be painful, but the very interesting, important thing that I think that's a really great contribution from Lo Xiaokun is that it might feel painful at first, but on continued massaging, it yields comfort. And what that means is there's an underlying, what do you say, an underlying deficiency there. And what happened, as we saw with Huang Yuanyu said, well, that deficiency, it eventually causes this heat. And so that's sort of almost this instantiation of that mechanism in one finding, right? Initially, when you push, it hurts. You're feeling sort of that heat and some of that blockage there. But as you continue to move the qi in that area, as you start to unblock that bind that's there, then it starts to feel comfortable as you push. As we know, if there's comfort upon pushing, it's usually a sign of deficiency. So I think that's a fantastic contribution from Lo Xiaokun. Now, he also says there will be, in the abdomen, it will lack springiness to a degree, okay? And also in the substernal area. So this is, again, as we said, springiness is a sign of the patient's overall deficiency or repletion, right, of upright qi. Now, this patient has an underlying deficiency of upright qi, right? So that springiness is not there to the same degree, right? And so that's why, for instance, Yuan Tian, Yu Zheng, another important Kampo practitioner, says that actually this is why Ren Sun is so important in Glomus formulas, because of that. This is like a sign for Ren Sun and Glomus formulas, basically that lack of springiness, okay, which is a sign of deficiency. Now, so that's the first thing. This Glomus is sort of number one. Now, on top of that, there's sort of like a big three for Banxia Xiexin Tang. That would be Glomus, vomiting, or nausea, right? Or borborygmus, so that sort of gurgling in the stomach. So all three of these are sort of like what you call sort of like the big three of Banxia Xiexin Tang among Kampo practitioners, and it's been embraced also by Jingfang practitioners in China. So now there's a few other things that Lo Xiaokun brings up from the Kampo schools. He says Katsutoshi Terasawa says poorly formed stools might be likely, right? And Ouyang Weichuan says, again, this potential for this stagnant water sound, which we also saw another of these Kampo guys, I'm not so good with their names, saying previously. Now, there's also a sign that I've seen, and that I'm not sure where, I don't know if Wang says this or what, but sometimes also you might see something which is the beginning of the stool is poorly formed, but then the end is formed, right? Or the end is formed, or the beginning is formed, the end is unformed. So that kind of contradiction there you sometimes see, where it's not one thing throughout all of the stool. Some of the stool is formed, some of it's unformed. That's another sign of that sort of deficiency repletion occurring together, right? So you can also look out for that, I'd say. Now, Huang says he agrees with that these primary traits, right, which are, again, these sort of like big three of Campo. But then on top of that, he says you might also see diarrhea is fairly common. Now, Huang actually also has a pretty cool one in terms of tongue. He says there is sort of like a Banxia Xiexin Tang tongue, actually. And that would be that the tongue has yellow and white coating appearing sort of at the same time. Now, they're also going to be less deficient looking, and the coating might be thick or slimy. Again, so that yellow-white, again, this sort of deficiency and repletion occurring at once, right? That thick or slimy being this sign of this fluid congestion or stagnation, right? Now, also the fact that there's the patient is not going to be very deficient looking, right? And so this again, being because, well, just despite the fact that they have they have this, Ganjiang and Rensun working, there's also Huangli and Huangqin, right? So there is this heat there as well. Otherwise, if they're just completely deficient, why are you adding Huangli and Huangqin, right? You could just use Li Zhongtang or Sinitang or some more complete deficiency formula. Okay. Now, on top of that, Huang is going to say you might also get these more mental signs, right? Like vexation, insomnia, frequent dreams, right? Which are all these signs of what? This heat that's not able to descend, right? Now, he does note, however, that these signs would be even more prominent in another formula, which is Huanglian Wendan Tang, right? Which is that Archen Tang we all know, plus Zhuru, Shike, Huanglian Wendan Tang also has very high Shengjiang. Okay. Now, in terms of pulse pattern, there's also a very interesting pulse pattern for Banxia Xiexin Tang, according to Chen Jianguo. So he says that the strongest pulse is going to be on the right guan, but the right guan will not be stronger than a normal pulse. So basically, the right Chi and Cun are going to be more deficient, but then on top of that, there's going to be this noted more powerful pulse at the middle position, but it's not going to be more than not going to be an extra strong pulse, because once we get to extra strong pulses, what you would call like a replete pulse as opposed to a deficient pulse, then maybe you need to purge if it's in or use stronger herbs if it's in the guan position there on the right pulse. Now, in terms of the other two Xiexin Tang formulas, the big three, there are other Xiexin Tang formulas. For Shengjiang Tang, the pulse will be stronger and might have even like a left-sided guan pulse. That's important. A strong left-sided guan pulse, which would be for Shengjiang, right? That's what we want to see. Now, for Gancao Xiexin Tang, that's an interesting one. You might see on top of this right side findings, you might also see a much weaker or thinner left side pulse. Okay, and then you might even see a rolling up pulse on either the left or right side. Okay, so both things to look out for. So let's now move into the case study section for Banxia Xiexin Tang. So we'll start out by looking at a case from Lo Kun Sao, who we just heard from in terms of ideas about the formula pattern for Banxia Xiexin Tang. So this is a female, 60 years old, and for the past couple of years, she's been vomiting after eating, 1 hour after eating. And in terms of a Western diagnosis, CC meaning chief complaint, she has superficial chronic gastritis was their finding. So current symptoms, there's burping, some bloating, and relatively soft BMs. The patient is slightly on the skinnier side, but not frail, and the complexion looks fairly healthy. There's no redness in the face, bleeding, or excitable temperament, no canker sores, anxiety, or insomnia, no severe vomiting. And so, lastly, upon palpation, there's some abdominal springiness, but there's a harder glomus in the substernal area that is initially painful and uncomfortable. It feels comfortable upon extended massage. And so here, local anesthesiologist uses straight Banxia Xiexin Tang, Banxia Huangqin, Ganjiang, Dangsen, Huanglian, Dazao, Gancao. Right? So we just heard from local anesthesiologist, so I assume some of this will make sense already, but just to make sure the context is there. What we just said in terms of what a lot of people in China will agree are sort of like the primary symptoms that they're looking for in Banxia Xiexin Tang are that borborygmus, then maybe some feeling of nausea, and then of course Glomus being perhaps the most important. So this person naturally has vomiting, right? So that's one of the three. They don't have borborygmus, so to speak, but they certainly have a harder glomus. So already you have two of the three. So what does that mean? Well, for Lo Kun Sao, now he's already narrowing it down to Xiexin Tang formula family, because he has what two of the three most common signs for these Xiexin Tang formulas. Naturally, for vomiting, you have tons of formulas that are used, right? You have Xiao Banxia Tang, Da Banxia Tang, Xiao Banxia Tang Jia Fu Ling. You have Zhu Jupi Tang, Shen Fu Dai Zhe Shi Tang, etc., etc. Tons of formulas. Not to mention, for instance, even like Xiao Taiwu Tang will have nausea, and so there are a lot of options there. But since we have that, especially that glomus, then we can start to look towards glomus formulas, right? Xiexin Tang formulas. Now, that being said, there are lots of different Xiexin Tang formulas. So what Lo Kun Sao's approach is, he says, okay, well, he's going to do sort of like a process of elimination, right? So, for instance, in terms of our big three Xiexin Tangs, Gancao Xiexin Tang, Shenghan Xiexin Tang, and Banxia Xiexin Tang, there are ways to differentiate, and we'll see this again when we look at those two formulas. But if you look at Gancao Xiexin Tang, he's going to look for some sort of canker sores or some sort of ulcers, either in the throat and in the mouth or below, right? This being coming from the Jingui Yao Lue and the use of Gancao Xiexin Tang and fox creeper or Hu Ho disease. Now, also anxiety and insomnia are quite marked in Gancao Xiexin Tang. Doesn't have those things, so he's going to cut that one out. Now, for Shenghan Xiexin Tang, he would be looking specifically for that severe vomiting and very uncomfortable feeling in the chest. And so he doesn't have that. She doesn't have that. So he's going to cut out Shanghan Xiexin Tang. So, and then Huang Lian Xiexin Tang would have that redness in the face, bleeding, etc. So he's going to cut that one out. So now he's done sort of like a process of elimination, and he's cut out. This is one way that you could think about doing sort of a diagnosis and then a decision-making process. Wouldn't be my first choice, but obviously also Lo Kun Sao doesn't really rely on pulse as much, so he's going to really look at those symptoms and also on palpation. Now for palpation, again, this patient has that telltale sign for him of Banxia Xiexin Tang, which is that when he initially palpates that substernal area, it's painful, but as he continues to do so, it becomes more comfortable. And sort of that area, that's feeling of fullness and blockage substernally actually opens up. So for him, that's a really telltale sign. And that shows him that Banxia Xiexin Tang is probably a good choice. Okay. So for someone like Lo Kun Sao, he really comes from like a Campo style model. And so for someone like him, we're not seeing so much of this thinking too much about the mechanism and the etiology of disease so much. It's really all about looking at these sort of subjective, objective signs that can point to using a particular formula. But as I said, with Banxia Xiexin Tang, the pithy gloss is that the person has sort of weak digestion, weak spleen, right? Deficient spleen, and then on top of that, that causes this impairment of upward and downward ascension and descension. And then due to that, of course, then we get this heat above and this cold below. So for this person, you can see that they have relatively soft BMs, which might be a sign of that coldness below. Then the other thing is that they have this pain a bit in the substernal area. Now, pain, of course, can be cold or heat. So it's actually not a very good indicator, but you could, because this person has this chronic gastritis, maybe to a degree, you could sort of argue that, okay, maybe this is a sign of heat. Of course, you know, sometimes it's very dangerous to equate inflammation with heat because obviously sometimes warming strategies are also very, very helpful for inflammation. But in any case, just to give you an idea of how this particular practitioner is approaching his diagnosis and treatment, that's one way to go about it. Now, we're actually going to look at yet another Campo case here. And this one comes from a very famous practitioner of Campo in the 20th century named Dome Yakazu. So this is a case of what they call cardiac neurosis. So that's fatigue upon exertion, shortness of breath, palpitations, all signs that kind of look like there's a cardiac issue, but without any actual organic disease. Now, the patient's main complaints at the time were fullness and bloating in the substernal area, glomus, and anxiety. And then the current other signs the patient has, they're tall and imposing, but with a narrow chest. Patient also complains of anemia, fatigue, cold feet, and insomnia. So in terms of palpation, we know these compo practitioners like their palpation. The abdomen is weak and lacks springiness, but there is a congested feeling substernally and water stagnating in the stomach. So you could hear that kind of water sound upon palpation. Tried a bunch of different formulas: Fu Ling Yin, Liu Junzi, Banxia Hobu Tang, Chai Hu, Jialong Gong Li Tang. But none of these touch the substernal congestion. To the contrary, they cause the patient to vomit and feel more anxious. So Dome finally used Banxia Xiexin Tang, after which the substernal congestion resolved, and the patient's anxiety and other cardiac neurosis symptoms resolved as well. Now, this is another really interesting case. First of all, because what? Like I say down here, some of those main signs for Banxia Xiexin Tang are not really present. There's no vomiting or nausea, at least until, before he used the wrong formula. There's no borborygmus that you might look for. Really, the only clue that you would have in terms of looking towards Banxia Xiexin Tang is the fact that they have this glomus, right? So they have that substernal bloating. So, this is a really good example of when you shouldn't be too, what do you call it? You shouldn't let the Western diagnosis dictate how you treat the patient. So the patient gets this diagnosis, it's some cardiac neurosis, and so you shouldn't be thinking, I immediately need to give this person Zhigan Cao Tang or some other formula that treats heart issues, right? Because the person's chief complaint is not that, right? The person's chief complaint is actually this substernal fullness and bloating and anxiety. So, and then on top of that, what is also really interesting is that the patient also has all of these signs that really just are not super classic for Banxia Xiexin Tang, like anemia, right? Fatigue, cold feet. If you just saw anemia, fatigue, cold feet, well, that's probably more like Dangui Sini Tang, right? Than it would be like Banxia Xiexin Tang. But really, again, you have to focus in. That's why chief complaint is really, really important. There are signs that are more important and signs that are sort of secondary. Now, some other signs that are really, really good for pointing towards Banxia Xiexin Tang or a Xiexin Tang formula, the fact that there's this water stagnating in the stomach. We said water sounds are sometimes common in Xiexin Tang or Shanghan Xiexin Tang. Now, the abdomen having that lack of springiness, but there then being a congested feeling substernally, I think that's a really good sign, because the abdomen weakness, this lack of springiness, sort of speaks to that lower cold, right? That's why you need that gancao, ganjiang, and rensen in the formula. But then at the same time, you have that congestion substernally, which requires that what they call xingkai kujiang, that acrid opening and that bitter descending aspect of Banxia and then Huanglin Huangqin, right? So that's some things to note on this formula. The other thing that's really important here that I really want to bring out is something that Chen Jingguo says, which is always treat the formulas that the patient has been on prior to this formula as symptoms in and of themselves. So that means if they didn't respond to these symptoms, that in itself is a symptom that you should be looking at. Okay, so you can sort of, for instance, just do a little bit of a thought experiment here. Like if you look at Fulingyin and Liu Junzi Tang, Fulingyin is actually very similar to Liu Junzi Tang. They both have sort of like a Sijun component in them. You might wonder, so why did this person experiencing the vomiting and anxiousness increased after using this? You can try to think about why that might be. Fulingyin, if we look at that formula, so I have the specifics here of Fulingyin. Fuling. It looks very similar to Liu Junzi Tang. The only difference being that you have 知识 instead of Banxia, then you don't have 大早. So that's really the only difference. Liu Junzi is 陈皮 Banxia, and then you have 四君子 on top of that, right? So I think the problem with these two, of course, is that there's nothing to treat the heat aspect, that heat above aspect, right? And so because of that, heat is actually just exacerbated, and that could cause anxiety for sure, right? Now, in terms of another interesting one would be, well, why did Chaihu Jialonggu Muli Tang work, right? That's often a formula that Kampo practitioners use for this sort of cardiac neurosis or any sort of what you would call functional cardiac disease without organic symptoms. They like to use Chao Jia Longu Muli Tang. But why wouldn't that work here? Well, sort of a similar situation. You have that Guizi and Caihu, which are going to be two ascending, right? And so in this case, if you have that Guizi and Caihu two expelling and ascending, it could cause the overall qi mechanism to sort of counterflow. And of course, that could lead to anxiety and vomiting as well. So it's always good to look at the other formulas that have been used. Truthfully, in my opinion, if you've used Fulingyin, don't go and use Liu Junzi Tang, because they're basically the same. The only difference is Banxia versus 知识. It's not a big enough difference. It doesn't alter the overall complexion of the formula enough. And truthfully, even Banxia Hopu Tang is sort of in the same vein. So it's a bit of a shame that he tried out all these formulas, but at the same time, it's also very honest of him to bring up all of his failures first. So that's also really nice. Now, the only other thing that I would note actually on that previous case is just if, when you look at these formulas, you kind of realize, well, this is why pulse is so important, because, for instance, Chaiwu Jia Longu Muli Tang pulse, it just looks so much different from a Banxia Xiexin Tang pulse. Even, Banxia Hopu Tang is really more on the left side. So I think if you're lacking that component, that really takes away from your diagnostic capacities. So let's move on now to another case. This from the fantastic dermatologist Ouyang Weiquan, treating prurigo well, that's hard to say, nodularis, male, 63 years old. So the patient's skin is covered in dark red, itchy nodules that neither Western or Chinese medicine has been able to cure. The nodules are hard and rough, extremely itchy, and interfere with sleep. Now, we see the patient has chronic gastritis, poor appetite, dry mouth, fullness, and bloating. Substernally, the patient easily has diarrhea if he eats the wrong food, but is also prone to constipation. The tongue is dark red, white coating, wiry pulse. So Ouyang Weiquan gives this formula, Banxia Xiexin Tang, right? This component is Banxia Xiexin Tang, and then over here are some add-ons: 全血 Weilingxian, 止咳 Baixianpi. After 7 packets, the itching was drastically reduced, the glomus was improved, but there was still chest oppression. And so then he adds Hopu, decreases the Baixianpi to 15, and switches the 止咳 to 止齿. Then after 5 packets, the glomus and oppression are gone. The nodules are starting to sink and disappear. After that, he adds 早饺子. After another 10 packets, all nodules disappear, okay? So as many of us know, Banxia Xiexin Tang and the Xiexin Tang family is very, very helpful in skin diseases. Typically, we think of Gancao Xiexin Tang as being the prototypical most helpful because we see it being used in the Jingguo Yaolue for the Huhu fox creeper disease with the ulcers. But Banxia Xiexin Tang is also quite helpful. And this has to do again with, you can just imagine if you have this heat that can't really descend, well, it's going to counterflow. And one place it can counterflow is outwards into the skin, right? So pretty simple stuff. Now, again, you can look at how Ouyang Weiquan goes about diagnosing this. Well, again, he finds that substernal bloating, right? Now, another really interesting and important aspect of this is, again, the patient has diarrhea, but is also sometimes prone to constipation. We said sometimes in that Banxia Xiexin Tang pattern, because it's this mix of cold and heat, sometimes you'll get alternating diarrhea and constipation. Sometimes you'll get the first half is more watery, the second half is more constipated, or vice versa. These are all good signs. Now, the other thing that's a really good sign is sort of this heat above, cold below that manifests in the signs themselves. So you have, for instance, this poor appetite, this diarrhea, which might look like a bit of cold, but then you also have dry mouth, right? Which might seem more like heat, or constipation, which might seem more like heat, right? So there's this sort of above and below thing going on. Now, so those are some objective signs. You have the wiry pulse, which again, like Shruqi said with Banxia Xiexin Tang, we often have either like a wiry or a slippery pulse. So that helps to narrow it down. You know, certainly this substernal bloating is a big thing, right? The glomus. And so you can see that apart from looking at the nodules themselves, a very, very important target for Ouyang Weiquan was the glomus itself, right? Because if you don't get rid of that glomus, that heat cannot descend. right? That heat cannot descend. And then the other thing that Ouyang says is that clear, so to speak, or sort of that nutritive essence from the spleen can't move out to the surface, and so that's why you're getting these hard and rough nodules, right? There's just this lack of sustenance getting out to the skin, sort of, is how, that's at least how he describes this particular situation. Now, another thing you could say is also Ying and Wei can't move out to the same degree, so they can't flush out this area of heat and subsequent stagnation that's occurring at the surface, right? Because there's just not enough of that Ying and Wei to move outwards, because getting blocked again by this Glomus contradiction at the substernal level, right? So that's really important outcome for him, is to see that Glomus is improved. Now he says there's still chest oppression. So also, again, like we said, the chest and the substernal area are sort of this area out of which Ying and Wei moves to the surface, right? So if that chest is also feeling blocked, well, same deal. You need to open that up too. And so he uses Hopu and Zhishi to accomplish that, right? So once you open up this what you call sort of this window to the exterior, and you allow Ying and Wei to flow freely outwards, you allow heat to descend properly, then the illness that's manifesting at the surface then goes away almost by itself, you could claim, right? And in terms of these other herbs, Baixianpi is a good herb for any sort of stagnation at the surface, manifesting in a sort of a hot purulence, or like we have here, like a nodule or any sort of skin disease. It's good for that. Sometimes they'll say Baixianpi sort of cures like damp heat at the surface, is one way it's described. Now, Chunxian and Weilingxian being used, I assume because the nodules are even hard. They're already hard, so it's almost as if to penetrate into these nodules and break them up, you need these substances that are called like network vessel unblocking, luo unblocking herbs like Chenxie and Weilingxian, right? Now, on top of that, he also used Zaojiaoci, is another good one, right? For if you're trying to get rid of, again, these sort of like hardened areas. And so that's another good herb for that usage. Now, for our last case, I realized that I haven't been mentioning too many gynecology cases, so I thought I'd address that issue. So I'm bringing a case now from Ma Dazheng, who is probably the preeminent practitioner of Jingfang gynecology. He's a big name. He's got thick book here with all this cases and stuff. So he's sort of a legend. And I will be bringing up some cases from a female gynecologist at some point, Yao Mei Yu. I also follow her stuff, but we just haven't gotten to the formulas that I want to use from her quite yet. So in any case, this is a case of morning sickness, female, 28 years old. 1 month into pregnancy, experiences nausea with vomiting, tepid watery feeling in the mouth, and reflux. Tongue is pale red with a greasy white coating. The pulse is thin. Okay. So after 2 weeks, all symptoms improved. And so we see the formula here. Now, for this particular case, the main thing is that this patient, remember we said for Banxia Xiexin Tang, a lot of Chinese doctors in China often look for that borborygmus, nausea or vomiting, and then that glomus as primary signs for using the three major Xiexin Tang formulas. And so this person has vomiting, right? And it's an interesting question as to why he would use this particular formula as opposed to, say, Banxia Tang, because or some other formula that could be used for morning sickness like Jupi Tang, etc. But in any case, just take it as an experience. Formula Ma Dazheng is like I said, he's sort of like a legend when it comes to gynecology in China. And so he uses, what you have here is Banxia Xiexin Tang, right? And then on top of that, you have Wu Zhu Yu and Hai Piao Xiao, right? So in this case, Wu Zhu Yu, I think probably because you get this tepid, watery feeling in the mouth. And so Wu Zhu Yu is often used when you have that. You're getting sort of more like water in the mouth, and there's in general just like a sort of excess of water in the stomach or the middle burner as a result of sort of a more deficient constitution. You notice this patient has a pale red tongue. Now there's a greasy white coating. Okay, so that can tell you that, as we say, Banxia Xiexin Tang is used to a degree for this dampness or phlegm stuck in the middle burner, right? That's part of what it does. So this greasy white coating, I think, can reflect that to a degree. Now, the other thing is that he's doing here is he's sneakily combining these two formulas to actually create another formula, right? Which is this 左金丸, Wu Zhu Yu plus Huang Lian, right? Is 左金丸, which is a classic formula used for reflux. Okay, so just something to keep in mind. And a lot of people will say, you can't use, and of course, Hai Piao Xiao is also good for reflux as well. Now, a lot of people will say you can't use Banxia during pregnancy. That's going to cause miscarriage. But as you can see, he certainly doesn't shy away from it, because the point being, if the person is already having such violent counterflow, it's that counter the downward movement of Banxia is actually going to be sort of like balanced out by that counterflow, essentially. And to that end, even in my personal opinion, Banxia is actually not a descending herb. The reason why it can descend is because it's sort of free. It essentially unblocks the middle burner and allows it to descend on its own, like Yangming to descend on its own. But actually, in my personal opinion, I think it's more of a unblocking and allowing Zhengqi to move outwards. I guess you could almost say it doesn't have a real direction. It just unblocks, right? And so that's my personal perspective on it.